The rotation is like seriously freaking awesome. Kind of pissed me off. As with surgeons, it's very like da 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 da. The bigger the group, the bigger the drama. They walk in and then they walk out.
Or they walk in and then they walk out.
Hi everyone, my name is Mercy. Welcome to my channel. I'm super excited for you to be here, and in this video I'm going to talk about my surgery rotation. So it hasn't been over yet, but I actually have 6 more weeks. So it's a total of 12-week rotation, and within the 12 weeks, so it's broken down where that it's 8 weeks of the actual core rotation, and then 4 weeks is considered as elective. So I have to actually do my my shelf exam within at the latest of 9th week. So that's when I'm gonna do my shelf exam actually, which is gonna be in about less than 3 weeks from now. So I'm gonna talk about the resources, how I studied, and how it's going, what I recommend, some tips. So everything I'm going to include in this video. With surgery rotation, it is one of the coolest experiences thus far. It's definitely my favorite, and actually I was told that it was going to be my favorite rotation, and it definitely has been. If you follow me on my Instagram, you kind of can see how much fun I'm having. And just the things that I've done. Essentially, you have your normal hours, weekdays hours, where you start at 5 o'clock in the morning and you end at 7 o'clock at night. The calls are then starts at 3 p.m. until 7 a.m. during the weekdays, and then on weekends you have the day shift and the night shift. The day shift is going to start from 5 in the morning until 8 p.m. and the night shift is going to be from 5 p.m. until 8 a.m. the next morning. There is someone on call every day. I have 10 calls. Depending on whether there's a lot of trauma cases at night, it does become fun. It definitely gives you an experience. So if you are thinking about becoming a surgeon, this is what you're going to have to do. If you're not thinking about surgery, then you know what the lifestyle of a surgeon is, a surgeon resident. I've seen so many things thus far, especially ortho cases are intense. A little bit this past week, I was like contemplating whether this is something that I might enjoy, but it's not. That's the important thing about the rotations. As you go through each rotation, you get to understand whether you can see yourself going into that field. So I can't see myself going into the surgery field because there's not that much patient care. I mean, obviously you're caring for the patient, you're saving their life, and you can immediately save their life, but it's just not enough patient interaction. Oh my goodness, whenever you're doing rounds, literally they walk in and then they walk out. Like, you don't even really talk to the patient. You're just like asking very, very specific questions, and you want very specific answers, and that's it. And then you're out. You don't even stand there to talk to them, to really understand the patient. See, that's the mentality of like internal medicine. That's the mentality of like, you know, the other sane. No, I'm kidding. As with surgeons, it's very like da 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 da. Okay, that's it. Which is good too. Depending on what your personality is like, I think that is pretty fitting as well for some people, just because it's like, okay, well, I just need to know pertinent things, that's all I care about, and then I'm out of there. And you're saving lives by doing just that, so that's important as well. And actually in the very beginning, it would kind of piss me off as we were going into the patient's room. Like, they weren't really asking, they were asking for pain, they were asking how they were doing, but they weren't listening, they weren't giving them more time. I mean, I get it, they're always on the go. It's just, I don't know, I got frustrated a lot in the beginning. I mean, I still don't entirely accept it per se, but I think I get it why. What else do I want to say? The rotation is like seriously freaking awesome. So there's a huge group of us as well. So of course, the bigger the group, the bigger the drama. Everybody essentially does their own thing because our schedule is such a way that you kind of have to do your own thing. Anyway, I won't go into details, but there are definite dramas that occur in just about every group when there's so much of you. I mean, luckily nothing before in my other groups except my first one, which was internal medicine, which was also a big group. Okay, anyway, so next. So the resources. So the resources that I use includes this book. It's called Dr. Prasanna's Surgery Notes. And this is an excellent book. At first when I started off, it was so boring. I couldn't take it just because it was just like fact filled. So it's just a lot of facts. It goes down to the point. It's not the easiest read, but once you go through it once, you need to go through it a second time, and it makes a lot of sense and you actually begin to love it. What I recommend is actually reading this, combining it with online med-ed. So I basically read this and took notes on it and then watched online med-ed, or I sometimes did the reverse, watched online med-ed to get the whole picture, and then I'd come into here and read, and then I would read this and take notes on it. My Muji notebook, which I absolutely love their notebooks. Like for example, gallbladder. Basically wrote out what it had to say, and that way like I can kind of compare them. So I think that's what I like, even though because everything is on here, you don't need to put it on here, but for me I like writing, and I like to kind of I wanted to kind of differentiate each of them, so then I wrote them next to each other, and then I added to it from what online med-ed said. You can even write on here, so you can do that, and then you can flip through and just read through. So you don't have to do this, you can just stick to this and put all the information on here, and you have everything you need on your Pastrana's book. And you can put sticky notes on there, or you can even get like another piece of paper and staple them on there. I don't know. Okay, so Pastrana's, online med-ed, and then I also did UWorld. It only has 131 questions or 36. I supplemented that with Exam Guru. This is the first time I've ever heard of it. If you guys want $10 off, there's going to be a link in the description box that's going to give you $10 off. So it's originally $37, but you can get it for $27 with that discount code. There's a lot of medicine in it, which is actually the good thing about it, is because there's going to be a lot of medicine on this shelf exam. I was actually told to go back to medicine, like GI, endocrine, pulmonary, renal, and heme. That's what I was told, to go back and try to do some of the questions on their section, so I'm going to try to. So I'm going to try to finish that. Some tips for surgery is to just try, whenever you're in the hospital, try to get involved as much as you can. Suturing is a really good idea. So actually they have suturing kits at the hospital. You can grab the suturing kits from there, just grab one, and then use a banana to practice suturing. And actually in the OR, depending on what doctor you have, the surgeon might let you suture. If you are brave enough to ask, you can ask them, and if they say no, then it's no, it's fine. If they say yes, then you get to practice. So it's really nice. Okay, well, I really hope that was helpful. I know if you can hear that in the background, there's a lot of people out there speaking. So thank you so much for watching. I will see you guys in the next one. Okay, so I really hope that was helpful. Let me know if you guys have any questions. Please leave a comment down below for any questions or any statements, and then follow me on my Instagram, Mercy Medical, as well as my other social media. They're all Mercy Medical. So I'll see you guys in the next one. Thank you guys once again, and thank you guys for subscribing. Yay!